Today's presentation with Dr. Roshan Pasra.
Hi, good morning. Thank you, Ms. Curlane. Good morning to Dr. Richards, members of the media, members of the viewing and listening public. So as usual, if I could have the dashboard for the 16th of August 2022, update number 1183. We begin at the top. Population vaccination status remains at 51.1%. That is, fully vaccinated to date 715,973 persons. Those who haven't received a first dose or any doses, 684,027. Boosted administered to date 167,786. New positive cases, 221 reported during that last 24 hours. And one death reported during that period as well, and condolences to the family of that individual. Total active positive cases now stand at 6,988. Hospitalization 228, and that now includes hospitals and step downs. And of course, vaccination status, those not fully vaccinated accounting for about 80% of the hospitalizations during the period July 22nd, 2021 up to the 10th of August 2022, and deaths again upwards of 90% of those who have died would have been unvaccinated at the time of death. If I could move into the number of patients in hospital. So again, breaking down total patients in hospital, 214. Those persons in step down, 14 persons at this time. And again, breaking down further, patients in the hospital, Couva Hospital and Multi-Training Facility, 88. 7 in ICU, 5 in the high dependency unit. Cora Hospital, 37. Augustus Long, 47. Arima General Hospital, 25. Scarborough Regional Hospital, Fort King George, 13. And Scarborough General Hospital at Signal Hill, 4. If I could have the first slide of the second presentation, which goes into COVID-19 and the monkeypox update from a regional and international perspective. As of the 17th of June, if we begin with COVID-19, we see over 6.9 million cases detected. BA5 now remains which is a sublineage of Omicron, remains the predominant variant worldwide and is increasing. And in Trinidad and Tobago, as my later slides will show, it is the dominant sublineage of Omicron as well. Local cases increasing and hospitalizations are increasing as well. And Dr. Richards will go into some detail with regards to the hospitalization. In terms of our variants of concern, as of August 12, 2022, Omicron continues to be the dominant variant in Trinidad and Tobago, detected in 103 out of the 108 samples. BA5 subvariant were the dominant Omicron sublineages detected in the recent samples, accounting for 78%. The BA4, less so, 11% of samples, so certainly BA5 sublineages outcompeting BA5, and now BA2 as well. BA2 subvariant were detected in 7.8% of the recent samples. Next slide. So switching a little bit to the monkeypox epidemiological update. As of the 11th of August 2022, 34,000 globally confirmed monkeypox cases in 88 countries across the globe. 8,066 additional cases, 31% increase in the last 7 days. New cases in Guadeloupe and St. Martin as it relates to the region of the Americas. Next slide. And again, just to highlight, it's important to know how to detect the rash and what it looks like. On the left, you'll see examples of pustules, you'll see examples of vesicles as well, and you'll see some crusting over in terms of the lesions. So just is important to be able to recognize what the rash looks like. And of course, the prevention tips will make reference to the rash as well going forward. Next slide. So just three overarching principles in terms of monkeypox prevention. And although we don't have cases in Trinidad as yet, certainly people would be traveling to areas where there have been increased prevalence of monkeypox, for example, the US, the UK, Europe, over this July-August season. And some of the prevention tips are as follows. Avoid close skin-to-skin contact with people who have a rash that looks like the monkeypox virus. So don't touch the rash or scabs of a person with monkeypox. Avoid very close contact. Next slide. So avoid contact with objects and materials that a person with monkeypox has used. For example, we're looking at not sharing utensils, cups, for example, and not to handle or touch bedding, towels, or clothing of persons with monkeypox. Of course, if you could go back one, of course, the exception would be those persons who have to care for individuals, and in those instances, we advise, of course, wearing gloves, wearing masks, and of course, taking them off appropriately after we finish handling those pieces of bedding and towels and etc. And of course, there are separate guidelines for healthcare workers. Next slide. So, of course, washing your hands as frequently as possible, or using an alcohol-based hand sanitizer, which is our recommendation, even going back to COVID-19, especially before eating or touching your face and after using the washroom, for example. Next slide. So this is in a graphic, basically what some key tips again for monkeypox prevention. We're looking at cleaning your hands often, wearing a mask in indoor public spaces where possible, consider limiting close contact, clean and disinfect frequently touched surfaces, stay home if you're ill or have symptoms suggestive, and get vaccinated if eligible in terms of the COVID-19 in particular. Last slide is just reiterating the necessity for the 3 W's, continuing wearing a mask where appropriate, watching your distance, and washing your hands. Thank you, Ms. Lane, for the brief time this morning.
Thank you, CMO. We now go to Dr. Richards, who will provide an update on the parallel healthcare system.
Thank you very much, Odessa. Good morning, CMO. Good morning to all members of the media. Thank you very much for continuing to participate and to support the Ministry of Health in our weekly press briefings. Good morning, Trinidad and Tobago, and to all our members who are looking on the viewing and listening population locally, regionally, and internationally. We appreciate your continued support and collaboration in understanding and in supporting the Ministry of Health's response to the COVID-19 pandemic. This morning, I will be sharing some information on the status of the hospitals in the parallel healthcare system as of 8 a.m. today. At present, the overall occupancy in our hospitals in the parallel healthcare system is 41%. There are 227 patients in the parallel healthcare system this morning, of which 215 are at the hospitals, representing those that are critically and severely ill, and 12 at the step-down facility that is currently activated, that is the area hospital Point Fortin. There are 15 patients in the intensive care units of the parallel healthcare system hospitals. At the accident and emergency departments in the traditional healthcare system, there are 28 patients awaiting transfer. Now, CMO would have indicated, as per the press briefing, the COVID-19 update yesterday, that we continue to see a trend of a large or significant proportion of unvaccinated persons or not fully vaccinated persons requiring medical care. And that trend is reflected based on the conversations and based on the statistics that we have been receiving from the clinicians at the accident and emergency departments and in our hospitals. And of course, between the 22nd of July 2021 and the 10th of August 2022, 80% of patients hospitalized in the parallel healthcare system are not fully vaccinated. This reminds us that vaccination is indeed beneficial and protective against acquiring severe disease and also prevents death. Vaccination as well reduces the risk of transmitting COVID-19 to those of us who have vulnerable relatives. So, for example, persons who cannot be vaccinated, such as the immunocompromised or young children under the age of 5. So let us all make an effort to encourage those who can be vaccinated to please ensure that they are vaccinated as well as boosted. As regards the ambulance system, we have also noticed a trend of increasing ambulance usage over the past month. And at present, 20% of the GMRTT ambulance system is involved in COVID-19 transports, that is from home pickups to hospital. And this has increased over the last month when it was under 10%. Ladies and gentlemen, just to give some context, up until the 17th of July or so, we would have been noticing a rolling average that was more or less stable. And over the past 5 weeks, we have noticed upward trends in the following areas. An increase in the confirmed number of COVID-19 cases. Today we stand at a rolling average of 280. An increase in the hospitalization numbers. Today we are at 227. We peaked at 228 yesterday, which is one of the highest numbers that we have seen since the general decline in May. We have also seen an increase in the accidents and emergency departments and an increase in the usage of the ambulance system for COVID-19. These statistics remind us that COVID-19 is still with us. And while we continue to move about and there are no restrictions, let us please take our personal responsibility and let us please continue to practice healthy behaviors. Let us please consider those amongst us who are high risk and those that are vulnerable and ensure that we take the necessary steps to protect them from becoming infected with COVID-19. As I close today, I would just like to recognize the efforts of all of our frontline medical staff and supporting staff in the parallel healthcare system and the traditional healthcare system. Our doctors, nurses, cleaners, clerks, ambulance drivers, laboratory staff, administrative professionals, CEOs and medical chiefs of staff have been working diligently, selflessly and continuously since we started to prepare for the COVID-19 pandemic in December 2019. They continue to be resilient. They continue to assist the Ministry of Health and support us. And as we continue monitoring the numbers and the number of patients requiring care for COVID-19, we must always recognize the efforts of our healthcare team. Thank you very much for listening to our update, and I now pass you over to Odessa.
Thank you, Dr. Richards. Next up is the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask your questions, one right after the other, to the relevant members of the panel. We will take 1 question per media house in all subsequent rounds of questions. Today, we begin with Rishad Khan, GML. Are you ready with your questions?
You're hearing me?
Yes.
Okay, hi. Right, so firstly, CMO. I know as of last week, we would have submitted around 9 samples for testing for monkeypox, which have all subsequently returned negative. What I want to find out is, do we have any more samples pending? And if you could expound for us a bit on what is the criteria for selecting samples or people to be tested for monkeypox. And my second question to you is, I know we're outside of the traditional flu season, but do we have any other viral illnesses that are circulating within the population right now? Because I'm hearing some people saying that, you know, we have the flu-like symptoms or we're getting tested for COVID, but it's not COVID-19. Thank you.
Yeah, sure. Thank you, Rashad. So after last week, we would have had 2 additional samples being submitted. Both of them came back as negative as well, so it takes us up to 11 samples submitted so far. In terms of the criteria, we had sent out a clinical case definition very early on in terms of to all the clinicians so that they know what represents a suspect case. Having said that, we haven't been very rigid in terms of the way we are applying it, meaning that we allow for some leniency if someone thinks that it is a suspect, not in the truest sense, but the rash looks a little odd or looks like monkeypox, then of course we allow the sampling to take place, and that is determined by the clinicians in the respective RHA. The algorithm that we speak to in terms of determining whether that rash looks suspicious is that the patient has to be referred to the dermatology consultant within the respective RHA, who is the competent individual to determine if there is another differential that we should take in mind before the sample is actually taken and sent. So that determination is done on clinical grounds. But generally speaking, the clinical case definition would have had fever, flu-like illness to some extent, body pains, headaches, for a few days, followed by a rash. And the rash would have been well defined, as I showed in the picture, in terms of vesicles, pustules, and of course sometimes crusted over if it is lingering. So that definition is a clinical case definition that has been disseminated to all the physicians. We have partnered with TTMA to do some training, and that definition has gone out to the private sector as well, so that as many people as possible in terms of the clinicians are aware of what the rash looks like and when to refer and how to sample. Your second question, if you could remind me of your second question briefly, please, Richard?
Yeah, the second question is if we have any other viral illnesses in circulation right now outside of COVID or even flu.
I think I would have mentioned a couple of weeks ago that we did pick up a few influenza cases, even outside the influenza season, which is a little bit odd. But again, when we apply a lot of pressure on a particular virus, it changes in the way it behaves. So over the last 2.5 years, the world would have been putting selection pressure on viruses by, of course, having public health measures in place, behaving in a certain way which is different from what was normal. So we are picking up some influenza illnesses, not a large number in terms of number. I think we would have been confirming about 6 or 7 on my last check, which was about a week ago. But it is odd to pick it up outside of the influenza season. There are other viruses that haven't been categorized as significant or serious, meaning it's not influenza A, it's not influenza B, it's not COVID-19 or the like, but it represents the normal flu-like, not flu-like, the normal viral illness continuum. So normal viruses, as part of the viral illnesses that go around in any given season, once you have increased movement of people, increased gathering, and of course the public health restrictions haven't been taken down, you find that you will get an upscale in the number of viral illnesses occurring.
Thank you, CMO. We now go to questions from Newsday.
Hi, good morning. Melissa Doughty, Trinidad and Tobago Newsday. Over the last 2 days or so, there would have been reports of the Lanya virus or concerns surrounding the Lanya virus. Is that something that the ministry has taken note of and is looking at CMO? And additionally, with that discussion, it came as well discussion relating to pandemic committees and the need to look at viruses, as some reports would have stated that the rate at which these viruses and diseases are emerging is also increasing decade by decade. How is Trinidad and Tobago responding to the calls for greater need to look at pandemics and emerging viruses and diseases? Dr. Parasram.
Okay, so I think it would have been last week's press conference. We would have indicated that this virus was a virus that was detected in China. It's part of a henipavirus, which is a group of viruses that have been in circulation before, but it's a new virus in that particular classification. So there was 35 cases that have been identified in China. It is thought to be animal to human at this point in time. A small cluster of diseases, it is something that we took note of and we continue to monitor through our networks. And I had indicated through the international health regulation networks, updates are normally sent. So just bearing in mind, there are usually clusters of viruses or clusters of unusual illnesses that occur throughout the world at any given point in time. What the International Health Regulation Network does, and the PAHO WHO, is that they will look at these diseases in terms of their propensity to spread, the dangerous, whether it is a dangerous infectious disease or not, and then they will give updates as it relates to those characteristics of the virus that seem to be concerning from a public health perspective. So we continue to monitor it. IHR hasn't put out anything directly to us as yet, neither has the Pan American Health Organization, but is something that we have on our radar in Trinidad and Tobago. I am also chair of the intersectoral committee that deals with COVID-19 as well as other emerging infectious disease. So when we would have taken the note to Cabinet to establish the COVID-19 committee, it also took note of the fact that there were other emerging infectious diseases that would come along, And part of our terms of reference is to continue to look at other emergent infectious diseases, of course, like this new one that has just come up. So we continue to do through the epidemiological surveillance pathways, look at all the new viruses that may emerge and monitor and evaluate, and of course put mitigation strategies in place.
Thank you, CMO. We have additional questions from Guardian Media Limited. Are you ready?
So I just want to follow up on my question that I asked earlier, right, about the prevalence of, on other viruses within the population. How prevalent are these other viruses that we're seeing? Meaning, and what I'm trying to really get at is, if somebody experiences flu-like symptom, is there equal chance it's something else other than COVID-19, or is it most likely COVID-19?
Right. So what you remember, we would have been presenting on something called the positivity rate over time, right? So generally, what the positivity rate that we have presented is suggesting to you is of all the people that are presenting to the facilities with a flu-like illness or a viral illness, what % of those people are actually positive for COVID-19? In the recent past, we have seen an upsurgence again with COVID-19, so it now accounts for 39% of all the samples that we are taking of people presenting with viral illnesses are now once again COVID-19. So close to 40%. So let us say 40% of those are COVID-19. It means that 60% of those are not COVID-19 and are something else, meaning flu-like flu. It can be influenza, and we have picked up some of those, as I said before, but it can be part of the normal viral illnesses. Could be sometimes you get presentations of prodromes with even gastroenteritis and other common cold, what we like to call the common cold, which are just normal rhinoviruses or other viruses that cause flu-like symptoms. So basically, as I said, 39% positivity rate, it means that the next 61% is some other virus, which is common in a population. Generally, outside of the pandemic, you'll find in the flu season that flu predominates, and then, of course, other things circulate as well. So there are many hundreds of viruses that tend to circulate in any population at any given time. For now, COVID-19 remains the dominant circulating virus at 39%, followed probably by influenza to some extent, and then, of course, the others are normal common cold-like viruses.
Thank you, CMO. We go back to Newsday for additional questions.
Yes. With school nearing its reopening, we know that you would have addressed the issue, CMO, but is there an uptake in people vaccinating their children in preparation for the reopening of school?
So when we look at the vaccination figures, even across the board, we haven't seen any increase in vaccine uptake. It has remained extremely low. Even within that 5 to 11 age group, we see that it has been very, very slow in terms of the number of persons coming forward to vaccinate their children. And again, we take the opportunity, of course, with school coming back on stream, we still have vaccines available for the 5 to 11 age group, that parents take the opportunity now to have their kids vaccinated before the opening of the school term. It gives that extra protection in terms of development of severe disease, and especially in that vulnerable group where you have persons with asthma, other comorbidities, obesity, in terms of giving them that protection that they need before school reopens. We urge the parents to come forward and have the vaccination.
Thank you, CMO. TV6, you have some questions?
Hello?
Yes, we're hearing you. Go ahead.
Dr. Paris, from you stated earlier that when you put pressure on viruses, they tend to change. Could you just give a bit of information as to what you mean by putting pressure on a virus? And on that note, I wanted to ask, is it possible at all that all of the sanitization and sterilization that people have been doing during the past 2 years, could that somehow be linked to the reemergence of certain viruses that we've been seeing and the increased virulence of viruses?
Okay, sure. So it is really a technical term in terms of applying a selection pressure. It relates to any organism. For example, in terms of the organism's ability to change and mutate. With viruses, because they replicate very quickly, they're able to mutate very quickly as well. So in terms of their subsequent generations. Once you put that selection pressure, in that sense means that you're applying some environmental challenge to them. So sanitization, having people distance, using mask wearing, and all of that is measures meant to control the spread of viruses. When you do that, and of course vaccination as well, it really helps protect the population as best as we can and prevent the spread of a disease. And that's why we have seen so many sublineages, and of course over time you see mutation of viruses occurring because viruses mutate. I mean, hundreds of mutations occur. What we have said before is the ones that we are concerned with, for example in COVID, are the ones that are now determined as variants of concern. Generally speaking, they tend to have a survival advantage in terms of their ability to replicate more quickly, to infect persons more, and of course cause more severe disease. So selection pressure, when I mentioned it before, was really just any environmental factor that causes a change, or that potentially causes a change in a viral species.
If there are no other questions, Renessa, your hand is still up. Is it that you have additional questions? Okay.
No.
All right. And with that, we have come to the end. Oh, sorry about that. Rishad Khan, you have some questions?
Yes, no apologies needed. I put up my hand a bit late. This question is for Dr. Abdul Richards. I know you went into a bit of the logistics within the parallel healthcare system right now, but do we have a percentage of what that rate of increase that we are seeing now is, and do we have any projections of where we're expecting that to go, given what we've seen so far over the past, I would say, 3-ish weeks since we've noticed that increase?
Well, we would have been seeing an increase daily. It's consistent, but it's not a very large or significant increase on a daily basis. But in terms of where we expect to go, of course, the hospitalizations will mirror the increase in the number of confirmed COVID cases. More COVID cases means that there are more high-risk persons who would be infected and they would be hospitalized. So the Ministry of Health continues to monitor the situation with respect to several parameters: the number of confirmed COVID positive cases, the accident and emergency admissions for COVID-19, the ambulance usage, and the requirements regarding the levels of care that we look at in the hospitals. And we look at this daily in order now to reactivate and to increase beds. So for example, this morning we added 10 beds or reactivated 10 beds at the area hospital Point Fortin step-down facility, because this is where the demand for care has reached. Thank you.
Your hand is still up, Rishad. Are you good, or you have additional questions?
Yes, I do have an additional question for Dr. Abdul Richards. Dr. Abdul Richards, I remember at the beginning of the pandemic, we were seeing rates such as that for all the COVID-19 cases we would expect around 18 to 20% of them to need hospitalizations. Now, granted, that was a different strain and a more immunonaive population to now. What is that rate like currently?
The rate currently, on average, is about 6%.
Okay, thank you. That's it for me.
Thank you all, and if there are no more additional questions, we've now come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. We want to remind the public that COVID-19 vaccines are available for everyone 5 years of age and above. If you have not received your COVID-19 vaccine yet, please get yours now. Remember, the vaccines are safe, effective, free, and available at multiple locations. We invite you to visit our website at health.gov.tt and our social media pages for accurate and up-to-date health information. Finally, as we continue to roll back restrictions, let's continue to observe the 3 W's. Goodbye for now, and enjoy the rest of the day.
In crisis situations, children can perceive anxiety, which can cause them to feel stressed. Depending on their age, their response may vary. Some may become overly attached, while others may withdraw. Some may become anxious, angry, or agitated, and others may even start wetting the bed. Here are 5 tips to help manage stress in children.